Welcome, dear all. I am Süleyman Pirat, and one of the board members of our association. I'm also responsible for the International Relations Commissions of our association. Today, we are going to moderate our webinar with
Hello, guys. I'm Tisnur Kazapoğlu from Yeditepe University, and I am the third year of dentistry students, also at same like Süleyman. I am also like international relations coordinator of our school. Nice to meet you.
guys, before we start our presentation, let's introduce our Dr. Manrina Rhodes.
Yes. Dr. Manrina Rhodes graduated from Guy's Hospital, London in 2002 and has since become known as one of the top cosmetic dentists in the UK. She continued her education at the top institutions around the world, achieving a master's level in advanced aesthetics dentistry at the prestigious New York Dental Institute and advanced occlusion techniques in Florida. Dr. Ruth first learned facial aesthetics in 2004. She continues to upgrade her skills and knowledge as technological advances demand. She runs a training academy for dentists, running a variety of courses, including a course teaching dentists how to porcelain winners called Designing Smiles. Dr. Ru's expertise in cosmetic dentistry has led her to be known as one of the leading cosmetic dentists in the world. She was the first dentist for Harvey Nichols and Harrods when she is not at her clinic. She is known to teach her well-respected cosmetic techniques, including teaching at the prestigious American Academy of Cosmetic Dentistry annual conference in Hawaii. Dr. Ruth always finds time to devote to charitable causes. She has been on a self-funded mission to Cambodia, overcoming extreme challenges. Dr. Manrina Ruth used her expertise and skills to help make a difference to underprivileged children. In recognition of her charitable work, she was named Maria Claire's 21st Century Woman. Dr. Manrina Ruth also sat for 3 years on the board of directors as chair of charity for the British Academy of Cosmetic Dentistry and spent a significant amount of her time organizing fundraisers for their chosen charity. Dr. Manrina Ruth, who has many awards, was selected as the Dentist of the Year in 2022. In 2023, it was again among the top 50 dentists. She is currently director of the British Association of Private Dentistry in the UK. She is the chair of communication and other executive committee.
Welcome, Doctor. Doctor, it's very nice to see you among us, and we are very happy. Before we are giving word to you, I wanted to say something. Guys, you can ask your questions from the live comments section. After the lecture, we will ask the doctor questions. Doctor, you can share your screen and start.
Okay, thank you. Okay, guys. Well, thank you for joining me today. I'm going to talk to you about the golden rules of aesthetics in dentistry. So we're going to talk about smile design. I guess most of you are dental students, and so a lot of these concepts might be new to you. And even once you graduate as a dentist, still a lot of these concepts can be foreign to dentists because they're not taught in dental school. It's something that you need to choose to learn when you graduate if you are interested in cosmetic dentistry. So let me tell you a little bit. Let's start with the case. So this is a patient that came to see me, and when you have a look at the smile, you think, oh, you know, what do we need to do here? And with her, it was very simple, just a little bit of contouring. So by understanding the principles of smile design and understanding that the front teeth were too long for the rest of her smile, and she had these mamelons that she'd kept as a child, which gave a childlike appearance, then by contouring them, it creates a really beautiful result. So very simple and straightforward, but very impactful. We're going to talk about the ideal positioning of gums, the ideal shape of teeth, ideal facial proportions, and how they all fit together. So as our adjudicators kindly explained to you, I graduated from Guy's Hospital, which is in central London. It's now known as King's College. And here's a picture of me back there recently on the campus where I graduated 21 years ago. I was really fortunate to start my career at Lundosler, which is a cosmetic dental clinic in Knightsbridge in central London. And this is a picture of Lundosler. As they said, I went on to open the first clinic in Harvey Nichols, which is a designer department store. We also opened a clinic in Harrods. Some of you will have heard of that. It's again, another designer store in London, which we opened a dental clinic in. We had a TV show called 10 Years Younger, and I used to go back and forth to America for a lot of my education. Now, fortunately, a lot of that education is available in the UK. There wasn't a lot of dentistry in the UK, so we used to travel to America to learn. I was part of the BACDs, that's the British Academy of Cosmetic Dentistry. There's also the European Academy, the American Academy. I worked at the London Smile Clinic. We did a TV show, and I took a little career break, so 10 years into my career, and I went to America. Around that time, Instagram came about. A lot of you will have Instagram pages and may be familiar with mine. This is my Instagram page, Dr. Marina Road, where I showcase the work that I'm doing. And if you're watching today, and if you want to post about it, then please tag me. I have a personal page, Marina R, and clinical page, Dr. Marina Road. So yeah, tag my clinical page, and I'd love to see what you enjoyed about today, or who it is that's listening today. Instagram's a really good tool for cosmetic dentists. It allows you to be seen. And from this, I had a lot of opportunities, TV episodes and radio shows, and a bunch of different things that I've done in my career. There's also a book called Instagram for Dentists by Shaz Memon. There's 2 editions out now, and he's featured me in both editions. So if you're interested in doing more on Instagram, then that's a great book to read. I think you can buy it on Amazon. I kind of want to start off with a take-home message, because I think that's really important for young dentists and maybe for all dentists, is to lose the ego. In dentistry, there's a lot of ego, a lot of people out there trying to think that they're very cool, and I think that we can all learn from each other, we can all help each other. So as dental students coming forward within our profession, I hope you guys lose the ego and come forward and work together. Never do anything for money. You do it to be the best you can be. However, the more you learn, the more you will earn. So make sure that you're always learning and being inquisitive and bettering your field. Don't be intimidated by bullies. Even though you guys are young dentists, you know who you are and you know what you're doing. So just remember that. And never stop learning. There's always something to learn. When you stop learning, life becomes less interesting. So really important. And I guess you guys know that because you're spending time on your Friday night to be here with us today. Help and support others. You are not each other's competition. You've made this group here of European dental students. I guess you're from all over the world. So I hope you all get to know each other and support each other and learn from each other what you're doing in your different countries and help to push our profession forward. Ask for help. You can ask me for help. You have my Instagram contact now, so message me. Look for mentors, look for support, help each other, and be humble and work hard doing something you love. I hope dentistry will be something that you will really love. I've really enjoyed my career. I've been a dentist for 21 years now, and I really enjoy every day at work. So let's talk a little bit about a smile and why it's important. It gives us the ability to express a range of emotions. It also has a big impact on how well a person can function in society. When you meet someone and they're hiding their smile, you know, not showing their teeth when they're talking, you will interact with them in a different way than when you meet someone who shows you a big smile and looks warm and welcoming. So that's what we're giving people. We're giving them the ability to show openness, to show welcomeness, to smile with confidence, and to showcase who they really are without sort of hiding it because they're hiding their teeth. So we're going to look at a range of different analysis, of facial analysis, dentolabial, phonetics, dental analysis, and gingival analysis. So all these things that we want to look at in trying to create a perfect smile. Facial components and dental components. So let's first of all look at the face. Let's look at a horizontal and a vertical disharmony. So this is called a stick bite. You won't have been introduced to it yet. It's not something that you would typically learn at dental school. It's something that's very valuable in cosmetic dentistry once you know how to do it. So you get the patient to bite together. You put a bite registration in their mouth. You put a stick in their mouth. And you would put it ideally parallel to their eyes. With this patient, his eyes are canted. So rather than putting the stick parallel to their eyes, I put the stick parallel to the horizon, to the earth, so it's straight. This is the way that we wanted to create his teeth. You also mark the midline, so you can see ideally where the center of the smile would be. And you're very careful about the cant of that. You don't want a sideways midline, you want it to be straight in the face. So this one bite registration gives a lot of information to the lab when you're trying to communicate with them to show what you're trying to create. For facial beauty, you're looking at alignment, symmetry, and the proportions of the face. So symmetry is beauty. You really want things to be as symmetrical as possible. Those things that are really beautiful in nature are symmetrical. So when you look at a butterfly and their wings, they're made beautifully symmetrical. So if a patient has an asymmetry in their mouth, you want to correct it and you want to make it symmetrical. If they have, say, a high gum on one side, then it would look better to break the gum high on the other side so that it was the same. It will look much more beautiful than leaving one thing different from the other side. When you do your photography so that you can analyze your patient's smile, you want to make sure the patient is looking directly straight at the camera. The patient on the picture on the left, you can see she's tilted her head slightly to the side, and most people will do that. They'll have a selfie side, they'll have one side that they prefer. So take the picture so you know which side they prefer, and then get them to sit really straight, look straight on at you, look at the camera so that you can get an image where you can assess the symmetry of their face and of their smile. You want to look at the interpupillary line. The teeth usually, like I was saying before, you want to make them straight, and usually that can be judged by the line between the pupils on their face. However, some people have canted eyes, so that's also something to look out for, make a note of. You want to see what the ideal midline would be on their face, and you want to see if their midline of their teeth is not correct. You need to decide if that's something that you want to correct. That's quite a big job to correct. And you want to have a look at their lip position and where that sits in their smile so that they can fully show their beautiful smile. With the face itself, the face should be the width of 5 eyes. So you can see here the patient's eyes, and you should have space between the eyes and the space in between of the same of the eyes on the sides. So 5 eyes is the perfect width of the patient's face and the perfect facial proportion. The width of the nose should be equal to the intercanthal position. So between where the eyes end, that should be the same as the width of the nose on a beautiful face. And the width of the mouth should be the same as the distance of the pupils when they're looking straight ahead. So you could put this picture up on Photoshop or any sort of, on Canva, and put the lines on the patient's face. So you can start assessing what it is that makes them maybe not as good looking as they could be, and what you might want to do about that. The full face is also divided into 3 parts. So the upper part is from the hairline to the glabella. So that's where the eyebrows are. The middle part is from the glabella to the base of the nose, and the lower part is from the base of the nose to the chin. And this is subdivided into a third, and then a further 2/3 down to the chin in an ideal face. In the dental component, we want to look at all these different things, the tooth exposure at rest, the incisal edge, the smile width, and all these. So I'm going to go through all of these one by one with you. Tooth exposure at rest. So at lips at rest, so that's when the lips are just slightly apart. You can ask them to lick their lips and then rest and see if you can see what's visible. Typically in a woman, you want to see about 4 millimeters of tooth tissue, and a man can show anything between 4 to 2 millimeters. What you don't want is them to be showing nothing. And as patients get older and their face drops, their lip drops, they show less. And so that can be quite aging. And so it's youthifying then to lengthen the teeth so there's more tooth visible. The incisal edge of the teeth should follow, so that's the smile line, should follow the lower lip. So it should start just at the edge of the lip and then slowly go along and back up again to create a perfect smile. Also the buccal corridors, so that's the space on the side of the smile. You look at the axial inclination. If you look on the left here, how her premolars are tilting inwards, and so that creates a narrow buccal corridor. And then when you broaden that out, I broadened it out for her hair with veneers. You can do it with braces, with orthodontics, with bonding, or veneers, and then that looks very attractive to see all the teeth like bang, 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 like piano keys going back in the mouth. Also, you want to look at how the dental midline sits within the facial midline. So that's the vertical contact between the maxillary incisors. So the contact between the two centrals and how that sits within the patient's face. It should be parallel to the midline of the face. And if you're not sure where that is, you can look at the philtrum, this low point on the lip, and that will tell you where the midline should sit. As we said earlier, the occlusal plane, so the incisal edge of the smile, should follow the lower lip. And you can see here all these smiles, how they're sitting nicely, following the lower lip and creating a beautiful smile. Tooth dimension is really important. So ideally, a central incisor, the proportion should be 1 to 0.8. So an ideal central incisor is usually 11 millimeters long. And about 8.2 millimeters wide. So you can start measuring the teeth. It's very interesting in smile design that there's so many studies done about how to create a perfect smile. And if you follow all of these rules that I'm telling you right now, it's very easy to create a perfect smile. It'd be very unusual if you follow these rules that you wouldn't create something very beautiful. Also, the teeth go further back in golden proportion. So when they're viewed from the facial, when you look at a smile straight on, then golden proportion is 1.6 to 1 to 0.6. So you can get these golden proportion gauges, and you can hold it against the mouth, and you can see if one tooth is too wide, if it's not sitting within golden proportion. Golden ratio also exists very much in nature. Things that are beautiful in nature will often follow golden proportion. So it's not just the smile, it's literally things that humans find beautiful. Gingival zenith. So this term means the most apical part of the gum margin. You can see here that most usually it lies just distal to the midline of the tooth. So on this central hair, we've got a line to show where the midline is, and then just next to it, there's the gingival zenith, the highest point. So it's just distal of the midline. On the laterals, it can sit in the midline and not look too bad. And then on the canine there, you can see also that it sits distal. This is showing the display of a gingival zenith, and it's showing how much of gum you want to show. So in an ideal smile, you show between your upper lip sits at the gingival zenith, or it can sit up to 2 millimeters above a gingival zenith. So this shows here a really good lip position. These are actually some veneers that I did. I think there's just veneers on the front 2 teeth, but you can see how natural they look and how we brought the characterization from the other teeth in to create a very natural result. Incisal embrasures. So these are the little gaps at the bottom here, little triangles between your teeth. at the bottom of the contact point, and these should get slightly bigger as you go further back in the mouth. So this one's the smallest, and then slowly they're a little bit larger to create a perfect smile. This shows symmetry and balance. So you really want the smile to be very symmetrical, especially the front two teeth should be perfectly symmetrical. If you want to create an asymmetry in the smile because you're doing a smile makeover and you don't want it to look fake, then the way that you would create asymmetry, or where you would put your asymmetry, is on the lateral incisors. So on the second two teeth, you could make them slightly different. But the central should be the same. The canines, premolar should all be the same. Just the laterals could be slightly different shapes. So smile design philosophy, you want to look at the size of the centrals. You want to make sure that they're a really good size and everything flows from that according to the proportions that we discussed. You want to look at the midline and make sure that the midline's where you want it to be and that it's not canted. You want to look at the gingival heights and the zenith, the highest point, and see if that's symmetrical and where you want it to be. You want to look at the axial inclination of the teeth, so see if the premolars are folding in or if the teeth are slanting inwards rather than being broad and all being visible when a patient smiles. And you want to look at arch form. So lots of things to look at and think about. Incisal edge position, the tooth proportion, the exposure at rest, when the lips are at rest, how much tooth can you see, smile line, and so on. We spoke about the central incisors being as symmetrical as possible, golden proportion, size of centrals, position of midline, cant of midline, arch form. So this is all shown in these images here. This is a before and after. At the top, this lady had these veneers placed by another dentist, but they still didn't look great. So she came to see me and I replaced them for her. And then you can see at the bottom where I've taken into account these measurements, it creates a much more beautiful smile. Phonetics is a really important part. You don't want to do a smile makeover for someone and then they can't speak comfortably. So once you finish your smile makeovers, there's a few different sounds that you can get your patients to make that can let you know if you've done something that's going to work well in their mouth. So first of all, the M sound. When you do the M sound, if you don't, rather than getting your patient to lick their lip so that you can see their tooth display at rest, you can get them to say M. And then when the lips rest, it will show you how much tooth they show at rest. And ideally for a woman, you want 4 millimeters. For a man, it could be 2 to 4 millimeters. E sound, when they make an E sound, the edge of the central incisors should sit halfway between the upper and lower lip. So get them to do that and check if you've got the length of their centrals correct. F and V sounds are made by the edges of the central teeth hitting your lower lip. So if that's not correct, it could be that you've made the teeth too long or too short, and so the F and V isn't sounding right, or maybe you've made the incisal edges too thick. So when those sounds aren't correct, you know where it is that you need to go to make some changes. And the S sound is made by the tongue hitting the back of the maxillary central. So if the S sound doesn't sound quite right, then it could be that you've made too bulky a crown on the inside there, and you need to make it more concave. Facially and personality-driven dental design. So, you have this guy that comes in just because if you just looked at his teeth, then maybe you'd be treatment planning a certain type of smile for him. You know, he's an older gentleman, maybe you'd want to give him something very natural. But when you look at his personality, that he's wearing his big medallion and his glasses, then maybe someone like this wants a big white smile. So you really need to take, as much as all these face and smile design principles are important, also their personality is really important in what you're creating to make sure you give them something that they like. This guy, again, is a character. So he comes into you, take the personality in mind. Don't just give the same smile for everyone. Try and understand who they are so that you're creating the right smile. And here's another example. I think from all these pictures, these people are really showing their personalities and maybe give you more of an idea about the sort of smile. I think for this lady, you want to create something very beautiful and glamorous to go with the rest of her. Let's look at some cases. So quite often I'll ask a patient to come in and see me before they have their braces removed, so that I could treatment plan and make sure that the teeth are positioned exactly as I would want them to be before the braces come off. So they go and see the orthodontist, have their braces, come and see me, I make a treatment plan. I could say, oh yeah, the gingival zeniths aren't quite right. Can you please intrude this tooth? The orthodontist could be looking at the edges of the teeth. But I'm going to build those up. So I'm not looking at that. I'm looking at the gum margins, but then I'm seeing how much of the gum margins visible. And then we're moving the teeth accordingly. So this is that same patient when she had her brace off. And you can see that she has all this wear on the edges of the teeth. So we treatment plan what we're going to do with her. So for her, I did 8 porcelain veneers. So you can see that was her before. She had her braces. We could do really minimal porcelain veneers because she already had a straight smile. So it was just sticking them on the surface, almost like false fingernails. And then there's pictures of me with the patient to show that we had fun. This patient also came to see me. She had 2 old veneers on her front 2 teeth. Her gum margins were low, so that there was gum showing when she smiled. So for the gingival zenith, we wanted it to be higher. Ideally, with the gingival zenith, the centrals are at one position, with the centrals being 11 millimeters long and sitting correctly in the smile. The laterals, the gum comes down a little bit and they're a little bit shorter, and then the canines are the same height as the central. So the gum position and the incisal edge position is the same as on the centrals. So we started planning what to do with her. And so for her, I did a gum lift on her 2 centrals and 10 porcelain veneers. As you can see, that's quite a change with broadening the smile, correcting what was happening with her before to something quite beautiful. This patient I showed you earlier with the two veneers on these front teeth. She came to me, she had 1 veneer on her central and the other tooth was discolored and this was a little bit wonky. So we said, okay, let's whiten your teeth, let's straighten the side teeth, and then let's replace the veneer on the central and pop a veneer on the other tooth. So it was a really nice minimal plan. We did the stick bite so we could have a look at where the cant on those central should be. And then I created these 2 veneers. You can see that she has recession above the veneers, and I left the recession there so that it would look very natural and look like her other teeth. If we put 2 big perfect veneers and went right up to the gum, then they would have looked too long. So it was a more natural way by taking everything into account to create a lovely result. This guy was really interesting. He had a missing central incisor. So his upper left one was missing, and someone had put some bonding on his lateral to make it look like a central. So, you kind of look at it and you think, oh, how are we going to correct this? And do we need to do all his teeth? He wasn't very worried about the midline cant, like his midline being over to the side. And actually, there was a really big study done that showed that you can have up to a 4 millimeter midline shift without the human eye being able to see it. So for him, we thought, let's see if we can create some symmetry and beauty without worrying too much about the midline. So this was his mouth up close. This is his mouth up close. We did his stick bite so we could see where the midline should be and where the cant should be. And then these are his temporary veneers on just his front 2 teeth. So you can see by just doing 2 teeth and making them perfectly symmetrical, that's with the lip up, but you'll never see like that. But when he's smiling, it looks perfect now. So a bit of whitening and 2 veneers creates a really beautiful result. So it just takes a little bit of thought, thinking about your plan and your design to create something very nice. This guy came to see me. He's an actor, and he had these worn front teeth and this gap between his front teeth. And he'd been acting for many years, but he was always getting the role of the side character rather than the main guy. And that's because he just looks a bit cheeky with his gap and his short teeth. And he had all these little gaps on the side as well. That we decided to close. So we decided to do 8 porcelain veneers, and we wanted to decide whether to close the gap or not. So I put him in temporary veneers and with a gap, and then we went on to Photoshop and I closed the gap a little bit. So this picture on the left, I closed the gap just a little bit, and the picture on the right, I closed the gap completely. So he could decide whether that's something he wanted. Quite often, patients feel nervous about closing their gap completely because they're used to it. But once they see what it looks like closed, then they understand that that's a much better option. So we closed the gap. and created a beautiful smile for him. And now he just made a film with Monica Bellucci. So he's getting the main roles now that he doesn't have these cute teeth anymore. This is before and after. This one, this patient had a tetracycline staining and fluorosis, this very like mottled appearance of her teeth, and someone had tried to repair it with a bit of bonding. So I went through, I did an in-man aligner for her to straighten the teeth, because you can see in the occlusal shot where they're crowded. So we could do some really minimal veneers. And then these are some temporaries. You can see the shine through because her teeth were so mottled. And then these were her final veneers. So, and these are her final veneers. I took this picture 12 years later. So still 12 years later, they're looking great. Peg-shaped laterals. For this patient, we did 4 veneers. You can see that just doing 4 veneers to just cover up the 2 centrals and reproportion the shape for the laterals, creates a really beautiful look. And yeah, and that's it. So this is my course. It's called Designing Smiles. I spoke about it at the beginning. All of you guys are really young to need to come and learn from me just yet. But once you've graduated and you're ready to learn about how to do these more, then please do come. And I'd love to talk to you guys more about these procedures and how I do these things. Well done.
Thank you for a beautiful presentation. And
sorry, my microphone is closed. Doctor, we got a very nice lecture. Thank you so much. Let's take some questions.
Yeah, actually, I had a questions okay, let's first from there.
What did you study after your undergraduate in order to aesthetic dentistry?
Yeah. So there's no actual speciality in cosmetic dentistry. So if you want to learn it, you have to learn it bit by bit, all the individual things. So I would start, you're working as a general dentist, and bit by bit you learn whitening, and then you learn how to do simple braces. So you could learn Invisalign, clear aligners, in-man aligner to just move the front 4 teeth. And then you go on all these courses and lectures to learn more about smile design, show an interest in it. So there's not a specific training pathway, but what you do need to do is learn every section of it one by one and start bringing it into your general practice. And as you bring it in and you get better, then you start doing more of just your cosmetic work, and you can leave more of your general practice and do more cosmetics. Obviously, when it comes to learning about how to do veneers, then you come and learn from me.
Okay, thank you, Doctor. She said you can.
Yeah, actually, that was my questions. I just saw that in your patient's mouth before he or she came to you, dental crowding on the lower incisors, commonly it appears like that. And it was my questions actually. I have see that they need orthodontic treatment, but due to their ages and due to the orthodontics appliance aesthetics appearance is very important for the older patient. So what is your treatment for them if they reject orthodontic treatments?
Yeah, so I think we always try and convince them that it's better that they have an orthodontic treatment to realign the teeth. And there's so many options available now, invisible options, like Invisalign type braces, where they're the clear braces they can wear, or they can have lingual braces. So it's stuck on the back of their teeth, and so it's not visible at all. So a patient's never too old to have a brace. A 70-year-old can have a brace if they want to. If they're worried about how it's going to look, then there's options out there that they can take that no one will know.
Yeah.
Okay, thank you. Another questions from Chise.
It is the same.
If they do not want ortho, yeah, if they don't want ortho, then yeah, there's options to without orthodontics where it can be fixed. The problem with obviously if you're going to use porcelain veneers, you don't want to cut the teeth if you can help it, because if you cut the teeth, then they're more likely to need root canal treatment, to have sensitivity and have problems. So you need to warn them of all of that, and you need to be really clear in your consent that you've told them that they really should have orthodontics. Otherwise, they're going to end up having problems. Because when they have problems, they're going to come to you and say, "Oh, now my teeth are sensitive. Now I need root canal," and then it's your problem. So yeah, ideally, you want to align the teeth before you do your cosmetic work.
Yeah. Okay.
Another questions again from Chis.
It is actually from me. Like nowadays, I see so many people have like gummy smiles, like the increase of the gingival tissue. What is your preferences? Because in Turkey, we always try to do gingivectomy, or we just want to increase the like length of the crown. But what is your opinion about like what is the differences in UK? What's your
well, you need to look at the smile design and how the smile sits within the face. If the two teeth are already 11 millimeters long and they're sitting where they should do within the smile, then you don't want to do a gingivectomy and make the tooth 15 millimeters long, especially when they have a gummy smile, because then they will look like a horse, and then they're not looking better. So you need to look and see if they've got a short tooth, if they've got an 8 millimeter, 9 millimeter central incisor, then you can lengthen it to bring it to 11. Once you understand about smile proportions, I have a water laser in my clinic, which uses a water laser to remove gum and then to remove bone. So it's very easy to do crown lengthening surgery without any blood, any pain, or any downtime. But there's lots of other treatments you can do. You look at the frenum in the top of their lip, and if the frenum is there, then you may want to cut that. And I cut that again with my laser, remove the frenum, and then they tend to have their smile lifts less. So there's not as much mobility of the lip. So you can do a small surgery. Some of them go for gummy smile Botox. The size of the teeth is fine, and they just want to control the lip. So it's these two ligaments next to the nose that lift the lip. So you pop a little bit of Botox on each one, and then when you're talking, you look the same, but you can't lift your lip when you smile. So lots of different treatments out there, depending on what's appropriate for that patient.
Okay.
Yeah, I mean, include the teeth orthodontically as well. And if it's really bad, you could look at a surgical option to cut bone from the maxilla and move the maxilla up in the mouth.
Yeah. Okay. Thank you.
Okay. There's a question from Hatice. She asked, first of all, thank you for this beautiful presentation. Which treatment options do you prefer to make the most aesthetic restorations with the least material loss?
Yeah, so I mean, if you use cosmetic bonding, then obviously quite often you don't need to remove any tooth tissue. You can just bond to it. The problem with composite is it will chip and it will stain. So it's not a great long-term solution, but it's a nice prequel, and it's nice to do for young patients. I do a lot of my work in porcelain, and when I do my porcelain work, I like to use Emax. Emax is it can be made very thin and it's very strong. So it can be made as thin as 0.3 of a millimeter. So if you think a millimeter, it's 0.3. It's very, very thin. And that can just be overlaid as a surface on the tooth to create a beautiful restoration. So it depends on the patient. But yeah, you want to use something very thin so you remove as little tooth tissue as possible.
Okay, thank you, Doctor. There's another question from Hatice. For example, some patients not suitable for the bleaching. What can we do in this situation?
So there's usually something you can do with bleaching. Even if the patient has tetracycline staining, then there's some evidence to show that long-term bleaching for 6 months, every day for 6 months, will get some improvement. If it's a non-vital tooth, if it's dead, it's got root canal, you can put bleach inside the tooth and do a non-vital bleach. If they've got fluorosis, so they have white spots on their teeth, then there's a really great non-invasive procedure called ICON, which soaks in the tooth. It remineralizes the white spots. White spots tend to be little pockets inside the tooth, little pockets of air. So the ICON flows inside the tooth, fills out the pockets, and yeah, it creates a really lovely result, and then you can whiten. So I wouldn't say no to bleaching. Quite often there is some bleaching that you can do, but if you say you do all of that and still one tooth, for example, is still not a good color, then yeah, you would look at using bonding probably won't be the best thing to change the color. So you're probably looking at porcelain.
Okay. There's another question from Berhan. Would you recommend going to aesthetic dentistry workshop while studying dentistry or after having completed your undergraduate?
And we got afterwards. I think you're learning so much right now. You need to learn all the basics of dentistry, and it's so much. So go and learn all that. And also, you know, I hear so much now. I don't know how it is with you guys, but in the UK, dental students just aren't getting enough experience at dental school in basic things, in cutting a crown or doing a filling, doing a root canal or perio. So you want to use your time to learn the basics of a healthy mouth as well as you can. And then once you graduate, you want to get out there, you want to practice those basics and really understand them, because the fundamental of any aesthetic work is having a healthy mouth. There's no way you could do cosmetic work on a mouth that's not healthy. So focus on health. And then once you've got the health, then learn the aesthetics. The aesthetics is really fun. But yeah, you can start learning that once you graduate.
Okay, doctor. There's another question from me.
Also,
Yeah, I have a question. What kind of way do you follow when a patient comes to you with a fixed prosthesis on the anterior teeth?
What kind of what do you follow?
What kind of way do you follow?
What kind of way do you
Yeah.
follow? So if they
What is
have,
your treatment plan?
okay, if they have a fixed prosthesis on their front teeth, so if they have a fixed brace,
Yeah.
yeah. So yeah, so when they've still got their brace on, if they come to see me, then I have a look at the position of the teeth, the good position of the gums, and see the bigger plan of what my plan is after the brace comes off. Am I planning on doing composite bonding? Are the edges worn and we need bonding? Am I planning on doing veneers because the teeth have cracks in them and whatever it is? And so you want to get the orthodontist to reposition your teeth as perfectly as they can for you to be able to finish your smile using the principles of smile design that we talked about, putting the gums in the right position, looking at the proportions of the teeth. You know, if you've got very small peg laterals that you want to build up, then you don't want the orthodontist to close the gaps, because you want the gaps there so you can then put a veneer or bonding to close those gaps in the right proportion. So you need to be able to see your end plan to be able to know what to do at that stage.
Okay, thank you, doctor. And also, I want to ask, how long do your treatment take?
Yeah, so it depends. Yeah, so I mean, the most cases that I do, and you'll see on my Instagram, is porcelain veneers. That's what I'm known for, and those are 5 appointments split up over 5 weeks. So a patient comes to see me over 5 weeks. The first appointment, we take records, so we design the smile. 2 weeks later, we put their new smile on in plastic. The next day, we have a look, we check it's perfect. Then they go away for 2 weeks. It gives my master ceramist 2 weeks to make their porcelain restoration. She hand makes them in Emacs. They come back 2 weeks later. We take off temporaries, we put on porcelain, and then they come and see me the next day and we check occlusion is perfect. They can floss and it's all comfortable and looks good.
Okay, thank you so much.
By the way, I have two questions more. One of them is nowadays, like usually the people or the children's always coming with an accident to like anterior incisors, for example, 11 and class 4 fracture. Do you prefer filling or like porcelain laminate? It depends, like age, I know, but what is your best easy way to fix it?
Yeah, so definitely on a child, you want to use composite because they're still growing, their face isn't fixed. You don't really want to do any sort of permanent restoration until someone's 21 years old. You wouldn't even be able to do an implant until someone's 21 years old because their skull is still growing. So yeah, composite's a really nice option. If they're a child, they don't want to sit still for very long, you can just build it up for them. And at the front of the mouth, it's not very difficult to get isolation from saliva, because obviously that's the issue with composite. But yeah, you want to do composite, you want to understand anatomy really well so that you can make a beautiful composite restoration for them and build it up.
Yeah, thank you. About isolation, the second question is also like I want to ask that. Are you like usually use the retraction cord for separating the gingiva from the teeth, or are you more prefer a rubber dam? Or
Yeah, so I don't really use either very much. I like to use an Optragate, which is like a plastic rubber thing from Ivoclar, Virident, that holds the lips out of the way so that I can see the whole mouth. And then I'll put a tongue retraction section inside the mouth to keep the tongue away and to suck the saliva, so the teeth are all exposed for me.
yeah, okay. Thank you. Thank you for everything, like answering our questions.
Yeah,
My
doctor, there isn't another question, so
We will let everyone enjoy their Friday night.
yeah, it was a great pleasure to host you. Thank
My
you
pleasure.
for giving us your precious time.
My pleasure. Good luck.
Hope to see you again.
Yes.
Thank you. Before the closing, can I just take a screenshot?
Yes, yes.
Okay.
It's not here.
Okay. 1, 2, 3. Second. Okay. Thank
Thank you
you.
so much.
Thank you. Have a good evening. Bye.
See you. Bye.